Imagine this. A person sits at home scrolling on their phone late at night. They have friends on social media, but no one to share their thoughts with. They feel cut off. They might even say, "I'm not depressed, just lonely." What if I told you that this feeling of loneliness, a psychosocial experience, might put them at higher risk for developing type 2 diabetes? New research suggests that loneliness isn't just bad for mental health, it may be a meaningful predictor of diabetes, one of the world's most common chronic diseases. And the more we understand it, the better we can prevent diabetes for millions of people at risk. Today, we break down the science in simple language you can understand and give you steps you can take right now to protect your health. What is type 2 diabetes? Type 2 diabetes is a condition where your body struggles to use insulin, the hormone that helps move sugar from your blood into your cells for energy. Over time, high blood sugar can damage your heart, nerves, kidneys, eyes, and more. Traditionally, we think of the big risk factors as poor diet, lack of physical activity, being overweight, family history. Think of insulin as a key and your cells as doors. In diabetes, the key no longer opens doors efficiently, so sugar piles up in the bloodstream, leading to organ damage over time. Statistics. Over 500 million adults globally have diabetes, and the number is rising. Research suggests loneliness may add a 30% higher risk for developing diabetes in some populations. But researchers now recognize that your emotional and social life, your psychosocial well-being, also plays a role. What is loneliness? Loneliness isn't just being alone. It's the feeling of social disconnection, the gap between the social interaction you want and the interaction you have. You can feel lonely even in a room full of people. Researchers distinguish loneliness, subjective feeling, social isolation, objective lack of social contact. Both can affect health, but loneliness itself feels deeper and more personal. New evidence. Loneliness predicts diabetes. A new Medscape article reports findings from major studies that show people who report feeling lonely are at a 32% higher risk of developing type 2 diabetes than those who don't. This comes from large research involving over 1 million people tracked for many years. Let's break that down. When loneliness was measured in adult participants, those who consistently felt lonely developed diabetes more often than those who did not. The link holds even when researchers adjusted for typical diabetes risk factors like age, weight, and physical activity. This suggests loneliness itself is not just a byproduct, but a meaningful predictor of future diabetes. Supporting research. What science shows. 1. Systematic review of 9 large studies. A major meta-analysis of 9 long-term studies showed loneliness was linked to about a one-third increased risk of type 2 diabetes. Social isolation also increased risk, though slightly less strongly. This means loneliness isn't a small coincidence, it shows up across diverse populations. 2. National and long-term follow-up studies. Other research finds similar results. People who often feel lonely have between a 14% and 24% higher risk of diabetes compared to those who never feel lonely. In one 20-year follow-up study, the loneliest participants were twice as likely to develop type 2 diabetes. These results come from surveys plus objective health records, so they are strong and reliable. 3. Loneliness accelerates prediabetes progression. Even among people who already had prediabetes higher than normal blood sugar but not full diabetes yet, loneliness sped up progression to type 2 diabetes. This was true even after adjusting for age, sleep issues, and lifestyle factors. This suggests loneliness isn't just a risk for healthy people, it worsens disease progression once risk has already started. How might loneliness cause diabetes? Researchers think loneliness can affect the body through several biological and behavioral pathways. 1. Stress response activation. When we feel disconnected, the brain interprets that stress as a threat, the same way it responds to real danger. Stress hormones like cortisol rise. High cortisol can increase insulin resistance, raise blood sugar, promote fat storage. Over time, this chronic stress response may push your body toward diabetes. This is supported by biology studies showing inflammatory changes linked with loneliness. 2. Sleep problems. Loneliness often leads to poor sleep, which independently raises diabetes risk because poor sleep raises stress hormones, reduces insulin sensitivity, increases appetite for sugary foods. One study even showed that restless sleep mediated loneliness's effect on diabetes. Progression. 3 behavior patterns. People who feel lonely may eat comfort foods, be less active, smoke more, drink more alcohol. These behaviors each raise diabetes risk. Loneliness in people with diabetes. Researchers also study loneliness after diabetes has developed. Over 30% of people living with diabetes report loneliness. Loneliness can make diabetes management harder. People struggle with diet, exercise, and regular care when they lack support. So loneliness may both predict diabetes and worsen it once it develops. Why loneliness matters for public health. Loneliness isn't just emotional, it's a public health risk. Healthcare systems traditionally screen for blood pressure, cholesterol, but if loneliness adds meaningful risk for diabetes, then we should assess social and psychological well-being as part of preventive care. Real-world example. What this looks like. Meet Sarah, 55 years old, lives alone, works remotely, rarely sees friends, eats fast food most nights, has high stress. She doesn't smoke or drink, but she says, "I'm not depressed, I just don't see friends much." After a decade of feeling disconnected, her stress rises, she gains weight, and her regular blood tests now show prediabetes. If loneliness had been recognized as a risk factor, she may have received psychosocial support. She might have been encouraged to join community groups. Her risk of diabetes could have been reduced. Loneliness is not just emotional, it's biological. People who feel lonely are at higher risk for type 2 diabetes. The risk remains even when accounting for diet, weight, and physical activity. Loneliness also makes managing diabetes harder once it develops. Step-by-step loneliness prevention and intervention program to reduce diabetes risk. 1. Individual-level interventions. Step 1. Self-assessment. Action. Use a validated loneliness scale such as the UCLA Loneliness Scale or simple self-questionnaire. Do you feel isolated? Do you feel left out? Do you have meaningful social interactions? Goal. Identify individuals at risk before diabetes develops. Step 2. Goal setting. Action. Write down realistic social goals. That is, talk to a friend 3 times per week or join one group activity per month. Tips. Focus on quality, not quantity, of social interactions. Step 3. Social engagement. Strategies. Join community clubs, hobby groups, or fitness classes. Attend volunteer opportunities. Participate in online support communities. Woeful of avoiding purely passive scrolling. Time frame. Aim for at least 2 to 3 meaningful social interactions per week. Outcome measure. Track interactions in a journal. Record mood and sense of connection. Step 4. Physical activity with a social component. Action. Incorporate group exercise, walking clubs, yoga, team sports. Benefit. Combine social contact with diabetes prevention. Measurement. Track minutes of activity per week and note social interaction benefits. Step 5. Stress and sleep management. Action. Mindfulness meditation, journaling, or breathing exercises. Maintain a consistent sleep schedule. Goal. Reduce cortisol and improve insulin sensitivity. Outcome. Monitor sleep quality, stress levels, and energy levels. Step 6. Nutritional support. Action. Eat balanced meals with others when possible. Tips. Family meals or community cooking programs improve social engagement and diet quality. Step 7. Professional support. Action. Consult a psychologist, counselor, or social worker if loneliness is severe. Goal. Address underlying mental health issues that may interfere with social engagement. 2. Healthcare provider level interventions. Step 1. Screening. Tools. Include psychosocial questions during routine checkups. How often do you feel lonely? Do you have someone to talk to about personal matters? Frequency, annually or during chronic disease screening. Step 2. Risk stratification. Action. Combine loneliness screening with traditional diabetes risk factors, family history, HbA1c. Outcome. Identify high-risk individuals for early intervention. Step 3. Referral and counseling. Action. Refer patients to local social programs, community centers, or peer support groups. Provide cognitive behavioral therapy or group therapy sessions for social skills and coping mechanisms. Goal. Reduce isolation, improve mental health, and lower diabetes risk. Step 4. Monitoring and follow-up. Action. Track patient progress using loneliness scales, HbA1c or fasting glucose for diabetes risk, lifestyle adherence, exercise, diet, social engagement, frequency, every 3 to 6 months. Outcome. Adjust interventions based on progress. Step 5. Education. Action. Educate patients about the connection between loneliness and diabetes risk. Tools, brochures, group workshops, videos, and social media campaigns. Goal. Empower patients to take proactive steps. 3. Community-level interventions. Step 1. Awareness campaigns. Action. Launch public campaigns highlighting loneliness as a health risk. Medium, social media, TV, radio, posters, community events. Goal. Reduce stigma and encourage engagement. Step 2. Social infrastructure. Action. Create safe, accessible spaces for social interactions. Community centers, parks, walking trails, clubs and hobby classes for all ages. Goal. Increase opportunities for meaningful social contact. Step 3. Structured programs. Examples. Buddy systems for seniors. Peer support programs for chronic disease management. Group cooking or fitness classes combining socialization and health promotion. Outcome measure participation rates, social connection surveys, reduction in loneliness. Prevalence. Step 4. Volunteerism and mentorship. Action. Encourage community members to volunteer or mentor others. Benefit. Engaging in purposeful activities reduces loneliness and promotes mental and physical health. Step 5. Policy and integration. Action. Include loneliness reduction in public health policies. Funding for social programs. Integration into chronic disease prevention plans. Outcome. Loneliness is addressed as a systemic public health factor, not just an individual problem. 4. Monitoring and evaluation, level, metrics, frequency, individual, social interaction frequency, loneliness score, stress levels, HbA1c, weekly journal plus quarterly labs. Healthcare, loneliness screening uptake, patient referrals, HbA1c outcomes. Every 3 to 6 months. Community, participation in programs, reduction in reported loneliness, diabetes incidence trends. Annual review. 5. Example timeline for individuals. Week. Action. 1. Self-assessment and goal setting. 2. Join a social group/class. 3. Start group physical activity. 4. Begin mindfulness or stress management routine. 5. Eat one meal with social contact. 6. Check in with healthcare provider if necessary. 7. Maintain activities, track progress, adjust goals. Expected outcome. Over 3 to 6 months. Improvements in social engagement, mood, sleep, stress, and potentially early markers of diabetes risk. 6. Key points to remember. Loneliness is a modifiable risk factor, unlike age or genetics. Preventive action works at individual, healthcare, and community levels. Interventions combining social engagement plus lifestyle modification plus mental health support are most effective. Early recognition of loneliness can prevent or delay type 2 diabetes. For individuals, build and nurture social connections. Stay active with group activities or clubs. Prioritize quality sleep. Talk to your healthcare provider about feelings of loneliness. For healthcare providers, ask patients about social support and loneliness. Include psychosocial. Screening in diabetes risk assessments. Offer referrals to support groups, counselors, and community resources. For communities, create safe social spaces for adults and seniors. Support community programs that reduce isolation. Spread awareness that loneliness is a health risk. Your health isn't just shaped by food and exercise, it's also shaped by meaningful connections. Loneliness is more than just a feeling, it's a measurable risk factor for diabetes. By paying attention to social and emotional well-being, we gain a new lever in preventing disease. Connect today, because your health may depend on it.